person who's about to have the balloon procedure done, what's a typical day if they're going to come in and they're scheduled for 9 o'clock in the morning? What's going to happen prior to them getting there, and what's going to happen when they get there, and then what's going to happen in their recovery? Can you take us through a typical procedure?
Sure. Now, a number of our patients like to have it done early in the afternoon so they can work that morning. And I tell them they can get up that morning, eat breakfast, they can eat a brunch, they can go to work. About 2 hours before the procedure, they take a medicine such as a Tylenol with the hydrocodone, perhaps 1 pill. Then they come to the office, for example, at 2 o'clock in the afternoon. We check their vital signs, which means their blood pressure, their pulse rate. We check their oxygen saturations. We spray a decongestant and numbing medicine into the nose, which we do often on our regular clinic visits. Then I take a cotton ball, which has a local anesthetic, basically a numbing medicine, and I put it at the entrance to the sinuses where we will be passing the balloon 10 minutes later. Then we just chit-chat with the patients, and 10 minutes later we come back and we pass the balloon into each sinus. For example, when we're passing it into the maxillary sinus, it takes about 10 seconds. The balloon has a light at the end of it so that when it's in the sinuses, the lights are off in the room and you can see the sinus outline light up like a Halloween jack-o'-lantern. And you can see it. That's your confirmation you're in the sinus. You can see it illuminate. Then we inflate the balloon for 10 seconds. And then usually the patients say, wow, I can hear the balloon inflate. And then so often the next words out of their mouth are, oh my goodness, that's it. That's the spot. The pressure's gone. It's open. It just really startles them when they can feel the sinus being open for the first time. Mm-hmm. The wonderful thing about the balloon is each sinus has a slightly different angle, and the balloon can be bent to the appropriate angle for the sinuses. For example, the frontal sinuses have a bend in the balloon about 85 degrees. These sinuses are up in the forehead. The maxillary sinuses in the cheek, there's a bend in the balloon that has to be about 135 degrees. The sphenoid sinuses, which are pretty much straight back, is about 110 degrees. So we will start off with the frontal sinuses. Mm-hmm. Then there's a little template that for each sinus you want, you place the balloon tip in the template and you can bend the balloon to the exact angle you need for the next sinus. So you can treat multiple sinuses with one instrument. Okay. And there's